Hey everyone, I wanted to continue on with our talk on a history of facial plastic surgery. And now I wanted to move on to the time point in which the field of facial plastic surgery started to become professionalized, in which formal training programs were established, and when formal courses were established and the teaching started to become standardized for everyone. So the founders of facial plastic surgery were actually among the first subspecialties to develop formalized training for their residents and physicians. And within facial plastic surgery, sort of two distinct fields emerged. One focused more on cosmetic or aesthetic surgery, and one focused more on reconstructive surgery. And I think this distinction was best exemplified by two individuals, Maurice Cottle and Irving Goldman. And these two people were influenced by one individual, and that is an individual by the name of Samuel Fomon. So Samuel Fomon was not a surgeon, he was actually an anatomist who somehow was able to operate on patients. And he compiled all known work on facial plastic surgery. He went as far as to visit Jacques Joseph to learn from him. And now I know I told you guys about the fact that Jacques Joseph was notoriously secretive and would hide his instruments. The story goes that Samuel Fomon paid one of Jacques Joseph's nurses to sneak him into his operating room in the middle of the night so he could copy the instruments and bring them back to the United States. He ended up forming a course called the Fomon course, which became very, very popular. And it was established in the 1940s in Manhattan General Hospital. It was one of the few places where you could get formal instruction on facial plastic surgery. The way it would work is that a physician, and it could be a new trainee to the chair of a department, would pay $50 and bring their own patients. And that $50 fee was for the privileges to operate on that patient. His wife, Samuel Fomon's wife, also was a physician, and they actually met early on in one of his earlier courses. And she not only put his textbook together, but served as a sort of in-house, quote-unquote, artist. She would pop into every case, and Samuel Fomon would have her double check and make sure everything was done appropriately. He would hold up a mirror and say, "Bring in the artist," and she would come in and make her comments and then leave. And this gentleman, Samuel Fomon, had a deep influence on his students, two of whom were ones I just mentioned, Maurice Cottle and Irving Goldman. Now, Maurice Cottle emphasized the importance of functional rhinoplasty over cosmetic rhinoplasty, and he was very concerned about patients' overall general health, their sense of wellness, and very concerned with how the nose related to the rest of the body proportionally. He obsessed over a specific area of the nose, and when he formed his own course, he would actually spend an entire decade focused on one narrow area of the nose and move on to the next in the next decade. He always made sure that at the end of every one of his courses, not only the other physicians were thanked, but every nurse, janitor, electrician, carpenter, and anyone else who assisted in the course were appreciated and given gifts, which I thought was really wonderful. And the other thing that I thought was funny was that he was equally difficult to everyone. He was a notoriously difficult trainer, and he was equally difficult to the new trainees as well as to the well-established chairs of departments. And he also became known for his Cottleisms or sayings, and I'd like to just kind of list a few of them. One is, "The best operation is one we don't have to do. We are second best. Never do a nasal surgery, anything you cannot undo. The amount you take off depends on the amount you wish to leave behind. And as long as you have a tip, meaning a tip of the nose, you have a nose." In contrast to Maurice Cottle is Irving Goldman, who also practiced in New York, and he was born in New York in 1898. And he actually became the first president of the American Academy of Facial Plastic and Reconstructive Surgery. He was excluded by other physicians who performed plastic surgery at their hospital, specifically Mount Sinai. And he actually wasn't allowed to perform cosmetic surgery there until he was asked to and did perform the rhinoplasties on the chief of medicine, the daughters of the chief of medicine at Mount Sinai. He ended up treating many celebrity clients, including Dean Martin, and he also started a course that emphasized the aesthetics of rhinoplasty in 1950. And it's actually the longest ongoing course in rhinoplasty in the world. He was also, like Maurice Cottle, known as to be a bit autocratic, and he would drag out lectures for a really long time. And the story goes is that people would have to hand in answers to questions, and so each day only one person would go to the lecture, bring all the answers from everyone else, and that way they didn't have to listen to lectures all day and night. So Irving Goldman and Maurice Cottle represent different sides or aspects of facial plastic surgery, and they emphasized one or the other. And they were both influenced by Samuel Fomon. And it was these individuals who really contributed significantly to the formalized training for facial plastic surgery, as well as the professionalization or the formation of governing bodies for facial plastic surgery. And I think that both are equally important because both emphasize equally important aspects of facial plastic surgery. And I think both are important things that a facial plastic surgeon should know and should pursue.